I'd like the clerk to please call the roll. Oh,
Say,
Senator Lewis?
Yep, Senator Lewis, and I'm here.
Madam Chair, you have a quorum.
thank you so very much. Well, before we get started with the bills, I'd just like to remind all of the members and those who are listening or watching that the membership on the committee will remain the same as last year. That Public Education Subcommittee will meet 1/2 hour at the adjournment of the floor session on Thursdays. Again, Public Education Subcommittee will meet 1/2 hour at the adjournment of the floor session on Thursdays. Health Professions Subcommittee will meet on Friday mornings at 8:30 a.m. The Higher Education Subcommittee will meet 1/2 hour at the adjournment of the floor session on Mondays. And the Health Subcommittee will meet on Tuesdays at 4 p.m. Public comment in full committee meetings will be limited to bills that did not have an opportunity to get public comment in subcommittee. The public comment in full committee meetings will be limited to 3 minutes per side. A link to register for public comments will be included with each posted full committee and subcommittee docket. With that, I would like to call up our first. I will call them in the order that I see them on the calendar for those who are present. Senator Stanley?
Good morning, Madam Chair. I'm appearing by Zoom. I hope that that is okay with you,
That's
Madam
fine,
Chair.
sir. Proceed.
It's always great to be before you, and especially during these times. The bills that I have before this committee are especially important. This Senate bill provides for, let me get the number right. This Senate bill provides for, this is Senate Bill 1106. It's a bill that this committee and our Senate has seen before and has passed. But it's a bill that came out of an investigation that myself, Senator McClellan, and Senator Marsden undertook when I was the chairman of the venerable Committee on Local Government, trying to find out what our problem was in the school system when it came to the modernization of facilities, why we were seeing such a degrading of the physical plant of the school that was interfering with our children's education. And Madam Chair, members of the committee, what we found was one commonality. And Senator Marsden and I then came up with this idea. And that one common thread for every school, no matter where it was in the regions, whether it be Northern Virginia or Southwest Virginia or the Eastern Shore or Hampton Roads area, was that our school roofs were deteriorating at a rate that was alarming. But not only was it alarming, it was causing the damage to creep into the inside. The water that could not be held by the roof of the school was then getting into the electronics, getting into the plumbing, coming through the roof, down through the ceilings and into the classrooms. We saw a number of occasions where there were classrooms where children were having to be moved on a monthly basis from classroom to classroom because the leaks from the ceiling were such that there would be 30 or 40 buckets in those classrooms and no one could actually teach in them because it was a disruption. Not only was it a disruption, Madam Chair, members of the committee, it was also evident that this was causing sickness to our teachers, the mold and mildew that would get in there. We smelled mold and mildew. It was pervasive. And that interfered with the learning environment. So this bill basically does one thing. It establishes a roof fund, a roof repair and replace fund through the Commonwealth of Virginia that is administered by the Department of Education. And it would be with a singular purpose, and that is to provide grants to school boards to be used solely for the purposes of repairing or replacing those roofs of public elementary, middle, or high school buildings in each local school division. The bill permits any school board to make such an application, and the prioritization, Madam Chair and members of the committee, of which school would get what money to repair those roofs would be based on need, the greatest need, based on the existing condition of the school building's roof. So what this would contemplates too is that what we would try to fund this school roofs repair fund with are funds from not only the state government, but also local match and even private interest, and creating private-public partnerships where those industries that are in those school divisions, certainly they understand that their workforce is being grown and educated right in those buildings, and it is in their best interest too, I would submit, to make sure that our schools can provide a modern and safe education for our children. It is not reasonable to replace every school with a modern one. But this is the way that we can start to stop the degrading of those schools to the point where we can then not only fix the outside of them, but we can modernize the inside of them. So every child, no matter what their zip code, whether they live in rural areas or inner cities, will have the same educational opportunity and be provided with the same and equal education as those children are in our public system in the more affluent areas of the Commonwealth of Virginia. And that's the bill, Madam Chair. And I thank you for your time.
Thank you, Senator Stanley. We appreciate your time as well. Are there questions from members of the committee? Please raise your hand.
Madam Chair.
Senator Newman?
Madam Chair, my computer's not quite doing its thing this morning. What is the budgetary impact? As I understand the good senator, it's going to be from such funds that may be made available. Is that correct?
Madam Chair, I'd answer the gentleman by saying yes. There would be only a fiscal impact based on the funding of that. I would intend to put in a budget amendment that would be the seed money for something like this. But creating the fund first, I think, is the important step. Understanding that it is a priority and making a commitment to it by financial means is the second step.
Madam Chair, thank you.
Senator Newman, further question?
No, ma'am.
Thank you. Well, with that question, Senator Newman, I think it's appropriate that this bill be re-referred to Senate Finance. Senator Edwards, you're recognized. Senator Edwards, could you turn on your microphone?
Sorry. I'm not used to high tech. Senator Stanley, is there a general estimate as to statewide what this would require?
Madam Chair, I'd answer the gentleman by saying I am unaware of exactly what the cost of replacement or repair of roofs would be. But I have talked to many administrators in different school divisions who say this is one of their greatest needs and also the thing that can eat up a maintenance budget very quickly. So it is not inexpensive. And so, you know, to repair or replace one roof can be 7 figures, can reach 7 figures. So if we extrapolate that over however many schools actually need this, it is significant. It is not insignificant. But what we're trying to do is actually make not only everyone aware of the need to do this by creating this fund, but let's have everybody having skin in the game, whether it be the state or local level, or even in our private industries, to try to make this a priority. So one would anticipate that over time it would not be insignificant. But the significance is when you stop the leaks of the roof and how that degrades the building, you're going to save enormously on the amount that you would spend otherwise in the other general maintenance on the interior of the building. So while it is a cost, I believe it to be an investment that will pay dividends in lower maintenance costs for those school divisions in the future.
Thank you very much.
Thank you, sir.
As I indicated earlier after the question from Senator Newman, Senate Bill 1106 will be referred to Finance.
Madam Chair,
Senator Newman?
I move that we report the bill and we refer it to Finance.
Second.
It has been moved and properly seconded that the bill be re-referred to Finance. And I think that's going to require a vote. I'm sorry, I can't get my machine going. Thank you.
Senator Lewis?
Yeah, this is Senator Lewis. Senator Lewis votes aye.
I'm sorry, what was your vote, sir?
Senator Lewis votes aye.
Ayes 12, no 0.
Ayes 12, no 0. The bill is referred to finance. Thank you.
Thank you, Madam Chair. Thank you for letting me be before your committee through my kitchen. I
Thank you so
appreciate
much,
it.
Senator Stanley.
Yes, yes, ma'am.
Second bill on the docket is Senate Bill 1132. The patron is Senator Suderline.
Thank you, Madam Chair. I just would like to verify that are the superintendents of Montgomery County and Salem City Schools on the line? You're asking tough questions. Alan Siebert. And you can ask. Mark.
Madam Chairman Lucas, Senator Suderline, I'm here.
Good morning, sir. Thank you for joining us.
Thank you very much for having us.
Madam Chair, would you like me to proceed then?
Yes, please, sir.
Thank you, Madam Chair. So this bill, Senate Bill 1132, provides that when severe weather conditions or other emergency events, we're thinking things like a water main break or something, make it so that a school and a school division is not able to provide in-person instruction at that time. The school may declare an unscheduled remote learning day where the school provides synchronous or asynchronous instruction or some combination in lieu of in-person instruction without a reduction in the compensation in basic school aid fund that we provide, the Commonwealth provides back to the school division for the event. And it outlines how we would do that. This situation is that we've done a lot better with a lot of us are working very hard to try to reopen all of our schools again. But one of the good benefits from this is we've gotten much better at being able to provide remote learning in unanticipated times. And in places out west where I live, we sometimes have a lot of snow days, and we're not trying to get rid of snow days, but what we have is like the situation 2 years ago when we were here in session. Roanoke County hardly went to school at all in the month of January because there were just so many snow days. And the idea, you're going to hear from the superintendents how they plan to implement it, is when you have the fourth or fifth snow day to try to make sure that we can get instruction to these kids at those times. I think that we've gotten a lot better at it, and I think this is something that we could do. And if you'd like, Madam Chair, I think you can hear best from the folks how they'd implement it. We've got the Montgomery County Superintendent and the Salem City School Superintendent on the line, ma'am.
Thank you. We'll hear from those persons on the line. You have 3 minutes.
Madam Chair Lucas, members of the committee, thank you for this opportunity and for your service to the Commonwealth. My name is Alan Siebert. I'm in my 15th year serving students and families as superintendent at Salem Schools. Salem is a DOE identified school division of innovation, and we serve a little under 4,000 students. I've already heard Senate Bill 1132 referred to as the killer of snow day dreams. That simply is not the case. Here are 2 actual recent examples from Salem City Schools and 1 hypothetical. In Salem, we've been providing in-person instruction since August during the pandemic using a hybrid schedule. In December, we had an early morning inclement weather event that resulted in a good old-fashioned snow day. Schools were closed, students slept in before playing outside. A few blocks from my home, children were sledding on a hillside. Last Wednesday, we had a water main break at our high school. We dismissed early and advised staff and students to take what they needed to work remotely. The excavation, repair, replacement, and subsequent water tests closed that school for 3 days. But our staff and students didn't miss a beat, and meals were made available at a nearby school for families with need. This bill is not about taking away snow days. It's about empowering communities to use tools and methods forged in the pandemic to provide flexibility in the future. Water main breaks are rare, but severe weather resulting in multi-day closures are not. We envision this permissive legislation having the most impact where there's a significant weather event, a severe snowstorm, a severe ice storm, a damaging hurricane. When after the snow day fun, there are questions about whether buses can safely serve a higher elevation, or if a few days after the hurricane, some schools in the division are not ready to reopen. Instruction can resume remotely, and that time would count because the learning would count. This bill simply permits localities to choose to establish a plan to provide continuity of learning. The BOE, the Board of Ed, Department of Ed could certainly promulgate guidance regarding the plans, but I don't think the Code of Virginia should prescribe the instructional methods. In Salem, we trust our teachers with those decisions. During the water main break, my son had 7 teachers do 7 different things. All were appropriate based on the different content areas and the different points of the instructional units. In Salem, we're actually looking forward to the next opportunity. It is our hope that one day in the weeks ahead, we'll be able to have a day we'll close to give vaccinations to our teachers. That will be another opportunity to shift to remote learning that would require flexibility in terms of methods for teachers. Please support this very modest level of optional empowerment in severe situations and post-pandemic years. Thank you for your time today.
Well, we certainly thank you for your time. Senator Suderline, do you have other speakers?
Madam Chair, I think, is Mark on the line? All right. The Superintendent of Montgomery County Public Schools, please.
Yeah. Good morning, everyone, and thank you, Senator Suderline, for introducing this bill on our behalf. I'm Mark Meyer. I'm the superintendent in Montgomery County. This is my 6th year in Montgomery County. We have approximately 10,000 students in 20 schools in this school division. As you know, the pandemic has made us think outside the box, and some benefits have come from this type of thinking. We've implemented both asynchronous and synchronous learning days when students could not come to school due to inclement weather. Basically, students who regularly come to school do what remote students have been doing all year, and this is to continue to participate in school. In Southwest Virginia, of course, we're in the Blacksburg-Christiansburg area. We can miss as many as 17 to 20 inclement weather days. And you know, this will allow for more consistent instruction. Typically, days are added to the end of the year. And this, basically what this does by allowing us to do this, it allows the instruction prior to SOL testing. When we're adding days to the end of the year, we're missing the instruction that's needed for this testing. Something else that's important to consider as we're moving forward is all divisions in the state are going to be beefing up summer school programs because of the learning loss that has happened. And that's something we're doing here. This will allow us to have a set end date without having to add makeup days to the end of the year, which will really help with scheduling of our summer programs for the kids who really need this instruction in the summer. So it creates a more consistent schedule. And we've shown that we can teach kids asynchronously and synchronously. We've developed the technology. Our teachers are doing an excellent job in doing that. So we would definitely appreciate your consideration. Thank you.
Chair,
Senator Howell?
may I ask a question?
Senator Howell has a question of the speaker.
Yes, I'm curious, of your 10,000 students, how many do you estimate don't have either access to the internet or don't have available computer?
Right. We're very fortunate here. We have done an excellent job in distributing MiFi devices. And, you know, and then we also have another program that if you don't have cell service, we're actually have partnered with a local company to actually give these students cell service. So we have very few, when I say very few, probably out of 10,000, 50 to 75. And what we're doing with those students is we're actually creating packets and getting them to them or letting them take them home. Usually snow is not something that, or inclement weather is not a surprise. We usually know it's coming. You know, we have the technology to know that, and our teachers have done a good job. We've already missed a couple of inclement weather days. We knew it was coming in advance and actually closed schools in advance, and some work was sent home with these students.
Senator Howell, further questions?
No, thank you. That was very reassuring.
Yes, ma'am.
Thank you, sir. Questions by any members of the committee? Well, just a second. I have a Tom Smith, a call-in listener who's on the line. Tom Smith, you have a raised hand. Okay, that hand has gone away. Questions by any member of the committee?
Madam Chairman, I move to report.
Madam Chair. Madam Chair. Senator Hashmi.
Senator Hashmi, you have the floor.
Thank you, Madam Chair. I just had a quick question for the patron. The bill indicates that the language will require, the bill requires that any remote learning days will replicate the quality that is comparable to any other remote learning day. Have we already established the standards or the guidelines for remote learning days? I know we've been engaged in this process throughout this particular pandemic, but do we have that defined at any point?
Senator Suderline?
Thank you, Madam Chair. I don't think that that's something that would be defined. I think it's something that you either are doing it or you're not doing it. To say that you've got to provide this level, it's of whatever they're doing, so that if things, hopefully we'll keep getting better at it, every year. Hopefully we won't need to, but we just will, because there will be some we won't need to in the way we had to. But that's the situation.
Dr. Hashmi?
Thank you. I'm wondering about that language then, that when we're stating that it needs to, excuse me, have the quality that's comparable to any other remote learning day. I agree with the intent of the bill, and I'm just wondering how we're going to have comparable quality if we don't yet have the standards, and maybe that's something the bill could clarify, or that we can posit that we will work towards developing clear standards for effective remote learning days, which I think is necessary for us to do.
Madam Chair.
Senator Newman?
Madam Chair, just briefly, I'm going to vote for the bill. I just hope that we will consider, as we kind of go through the process, to the senator, that I'm a little concerned that ultimately you could end up with a snow, and then as the snow lingers, you could end up with weeks and weeks, not now, but in 10 years or 20 years. And maybe at some point through the process, we should consider whether or not there could be or should be some kind of a limit on the number of days early on. I'm not going to propose that today, Madam Chair, but it just seems to me that while the intent is all very good, and the superintendents and David are doing a great job with this, it seems like there may be some forms of limits at some point in the legislative process may make sense.
I think Tom Smith is available for comment.
Yes, ma'am. Yes, Madam Chair, it's Tom Smith with the Superintendent's Association. We just stand in strong support and want to make the point that this is a bill that would benefit the entire Commonwealth, not just Southwest Virginia. Think of times when we have inclement weather in Tidewater area, Northern Virginia. And so I think this is a good first step. The department typically would provide some guidance in terms of what they would count as a day. And so I think that might help with answering some of the questions of uncertainty on that. But we stand in strong support of the bill. Thank you.
Thank you so much for your time this morning. Questions by any other member of the committee?
Madam Chair. Peterson.
Senator Peterson?
Yes, thank you, Madam Chair. I have the same concern Senator Hashmi does, which is how do we put boundaries around this? Because it talks about any emergency situation. Well, we're in a status right now where we've got a state of emergency that's going to be pending for 10 months and soon to be a year. And it seems to me that, and this is a larger discussion we're already having, but I'm worried about making this too open-ended. So I understand the specific situation for Southwest Virginia, but this is going to be a statewide bill.
Yes, it is.
And so sadly, I may not be able to support this because I just think that this is creating a precedent that it may just give a blank check to local school divisions to not open.
Madam Chair?
Senator Suderline?
Thank you, Madam Chair. I share the Senator from Fairfax City's passion for opening school divisions across the Commonwealth for in-person learning. I've got the highlighted version up. Let me get the PDF version up back again. But it says unscheduled on line 30. So this is not something that you can simply say, this is just what we're going to do for this long period. This is the scenario in which, you know, you get the alert the evening before saying there will be a 2-hour weather delay, or there will be the school is closed. It is not and for the next 6 weeks, we're just not going to school. I mean, it's specifically unscheduled. I don't know if folks want something clearer, but that was the thought, to make sure that clear, because I share the senator's passion.
Thank you, Senator Suderline. Senator Peterson?
I'm sorry, I forgot to, Mike. I think the best, and again, I may just abstain on this. I understand the specific situation. Again, I think there need to be boundaries, and it may be that you can't do this for more than 3 days without, you know, some type of approval from Department of Education or what have we. I just feel like we need to put some boundaries on this because any school division could take this and run with it. So, just I don't have an amendment at my fingertips, but I think we need to work on that.
If there are no further questions, I'd like to entertain a motion.
Madam Chair, I already moved to report the bill.
It has been moved and probably seconded the bill be reported. All in favor, please vote electronically.
Senator Lewis?
Yeah, this is Senator Lewis. Senator Lewis votes aye.
Ayes 12, no 0, 1 abstention.
Ayes 12, no 0. The bill is passed. Bill will be reported.
Thank you, Madam Chair.
Thank you. On my list, I'm trying to take them in an order that makes sense. Senator Keegans has several bills, and when she's up, I'd like for her to have all her bills heard at one time. So at this point, I move to Senator Favola, Senate Bill 1154. Thank you. Good morning, Senator Favola. Could you please join us in front? Here, please, at the podium.
I'm just glad I found the room.
Senate Bill 1154.
Yes, thank you, Madam Chair. Senate Bill 1154, I think, provides an addition. Senate Bill 1154 provides additional guardrails for those who are residents in some of our group homes. So it does a couple of things. I think I'm going to have to take off my mask. I apologize, but so what this does is it requires the reporting of serious injuries and serious illnesses into a database that our designated advocacy group, it's the Disability Law Center of Virginia, so they can access now information about the care in homes that are licensed by the department and provide children's residential services. So that's the first thing. And the second thing is allegations of abuse or neglect, whether they're substantiated or not. in homes that are licensed or operated by the state. Those kinds of things would also now be part of this database. There's no additional burden on the providers. This information is already required to be reported. It doesn't always get into this data system, which is incredibly important, so advocates can look at trends and look at sort of the quality of care, see if there are alarming signs that need to be addressed. So I think I should move my amendment in the nature of a substitute. I just explained the substitute. So, Madam Chair, I have an amendment in the nature of a substitute.
There's a motion and a second. Yes.
How can we review the substitute? Madam Chair, members of the committee, we just hit the button so that it should be uploaded to LIS momentarily. Madam Chair, can we have a confirmation when it's up?
Yes.
Madam Chair.
Senator Newman.
Madam Chair, while we're waiting for it to upload, I think most of us have read the bill, Senator Favola. Can you just explain what the difference is between the substitute and the bill? We can see the bill.
There was the Department of Behavioral Health Services asked for specific clarifications. So when you're looking at the Children's Residential Services, you're looking at providers who are actually licensed by the department and not the department doesn't operate children's residential services, so they wanted that clarification. There is a House companion. Delegate Orrick is carrying this in the House, and we think they're exactly alike. We've been working with the Disability Law Center on this. And in fact, I believe Colleen Miller is probably in your speaking queue.
Colleen Miller is in the queue. And so, Colleen, if you'd like to join us.
Madam Chair, if I may, the substitute is available now on LIS.
Thank you.
Good morning, Madam Chair, members of the committee. This is Colleen Miller from the Disability Law Center of Virginia. I'm the Executive Director of the Disability Law Center. Thanks so much for considering this legislation, and thank you so much to Senator Favola for carrying it. Senator Favola carried legislation a few years ago that gave the Disability Law Center of Virginia access to something that the Department of Behavioral Health calls serious incidents. And those are primarily medical incidents in community providers and providers that are licensed by the department. So this legislation extends access to reports of abuse and neglect rather than just of medical incidents. Community-based providers are already required to make these reports, so it does not put any additional burden on them. It just gives the Disability Law Center as an independent agency, separate from the state, gives us some access to that information and allows us to analyze patterns and seek to respond to those patterns.
Thank you so much, Colleen, for that presentation.
Madam Chairman, Senator Donovan.
Yes, I'm sorry. I'm trying to get used to this room, so when I hear voices, I'm having to look around to find out where people are. Senator Donovan, you have the floor.
Madam Chairman, question for the patron.
Yes.
Yes.
I just, as a provider and looking at requirements, and not a provider in this arena, but clearly they're reporting more things than they reported before.
Mm-hmm.
So there is a change for the providers.
Madam Chair, my understanding is that they were required to report these elements through regulation, And we are now just putting it in code, and we're referring back to the reg. So the regulation may be updated or may be changed, which is true.
And follow-up question, Madam Chairman.
Senator Donovan?
When I follow the links, just for transparency's sake, when I follow the links to this 13.2 400, it's just, again, that the board can promulgate. How do these establishments know what they need to report?
Madam Chair, I would go down to 37.2 400 and then go to the regs, the regs that are promulgated associated with that. And I didn't bring my, let's see, maybe. Some of the examples would be, just to give you a flavor, let's see. For example, whether an act resulted in a physical or psychological injury, whether there was an allegation of abuse or neglect. Those are the kinds of things that are required to be reported now, at least through the regulatory process, is my understanding. What this is doing is allowing access to broader information on behalf of the Disability Law Center, which is both a state and federally designated advocacy group for those with disabilities.
Follow up, Madam Chairman. I have no problem with the intent of the bill. I'm just trying to make sure it's clear. Is there a better link that we can, I can't get to the regs here. I'm more interested in the medical incidences that you need to report as opposed to abuse or neglect, because that seems to be kind of a new intent of the bill. If it's been reported in regs before, that's reassuring, but I'm just curious if we can see what that list of medical reporting requirements are.
Senator Favola?
Madam Chair, I can give examples, or we can rework that language a little bit, but I think the department was more comfortable referring back to regulations that would actually go through a very robust deliberative process with a lot of stakeholders at the table, including the providers. So
what are, may I ask, Madam Chairman, just medical examples other than the abuse and neglect? What are reportable medical incidents?
Okay, a medical example would be if an individual got sick enough that he or she needed to be transported to a hospital, and that kind of information we don't have, the advocacy group doesn't have access to.
Senator Donovan?
Thank you, Madam Chairman. To speak to the bill.
Yes.
I do think that needs clarification, either in, maybe I just need to see what this list is, but I can't get to what those requirements are based on the way the bill is written, because it takes you just to the regs without having a list. I understand those regulations can change, but I think, I would like to see that only because I think it's important that these organizations that have to report have easy access when code changes to what their responsibilities are.
I agree with the transparency part. Madam Chair, may I ask staff to, part of this is a drafting preference as well. So may I ask staff to respond to Senator Donovan's?
Yes.
With your permission?
Yes, Senator Favola, you may.
Do you just want to kind of vote, and then we can work on a substitute after the fact, because I think we need to have a broader conversation based on that, if that's okay. I don't have a substitute or language prepared right now. We need some time to talk about it to sort that out.
Madam Chairman, I think that's...
I didn't quite hear all that.
So, Madam Chair, I think that what might work is we could send this to the Health Subcommittee and work on some language, if that is...
I think that's appropriate.
That's fine. I'm amenable to that.
Okay.
Okay, Senator Favola, the bill will go to the Senate Health Subcommittee, and be heard on Tuesday at 4 p.m. You good with that?
I'll be there, and we'll have, more people will have had an opportunity to actually look at the substitute language. So this,
Right.
thank
but,
you.
But before you leave, Senator Favola, we have a Deb Nair with a raised hand to speak. And with that, I'd also like to remind all of those in the room that when you like to speak, if you would please raise your hand electronically, then I don't have to try to listen for your voices or waving your hands in the back of the room. So all speakers, please designate your interest in speaking electronically, please. Thank you.
Good morning, Madam Chair. This is Dave Nair. I'm sorry, my audio cut out for a second, so I wasn't sure if you
You're fine.
were
We're making some adjustments this morning, first meeting.
okay. I'm with the Department of Behavioral Health and Developmental Services, and I was just making myself available to address any questions. I could note that the regulations refer to our regulations for licensed providers, and they do specify in there serious incidents, which must be reported by all providers to the Department of Behavioral Health. Those medical incidents could include a hospital admission, an emergency room visit, or a serious injury that requires medical attention. They are currently reported to the department. This bill, actually, in terms of serious incidents, this bill just aligns the language with what's in our regulation, because that requirement for us to make those available to the Disability Law Center has been in code for a couple of years. And this bill adds a requirement that allegations of abuse and neglect that are reported to providers under our human rights regulations would also be made available to the Disability Law Center.
I thank you for that presentation. And since this bill is going to the Health Subcommittee on Tuesday at 4 p.m., Senator Favola may choose to have you available to speak again at that time.
Yes, we'll make ourselves available, and we'll come with the regulations, because that seems to be the concern that's here. This, just so you can align, just so you have that comfort level. Happy to do that if that brings everybody along. Thank you.
Thank you very much, Senator Favola. Again, I'd like to just follow the schedule such that it puts Senator Keegans in a place where she can have all of her bills heard at one time. So at this time, I'd like to hear Senate Bill 1175, and the patron is Senator Ruff. He's coming in?
Thank you, Madam Chairman.
Good morning, Senator Ruff.
Senate Bill 1175. It probably took me longer to walk up here than to talk about the bill. When Brunswick County went to an elected school board, somehow they did not get removed from the list of counties that have appointed school boards. The appointed school boards have a locked-in price or salary for the employees.
Correct.
This just strikes them from that group, so they will be treated like all other elected boards.
Senator Saslaw, I heard your voice.
I was just going to say I move we report the bill, which we're not talking rocket science here.
It's been moved and properly seconded that the bill be reported. All in favor, please designate electronically.
Senator Lewis?
Senator Lewis votes aye.
Senator Cosgrove? votes aye.
Ayes 14, no zero.
Ayes 14, no zero. The bill is recommended to be reported. Thank you, Senator Ruff. Now I'd like to have Senator Kiggins to come forward with Senate Bill 1147. Thank you.
Got two bills.
Good morning, Senator Kiggins.
Good morning, Madam Chair.
You had one bill before the last two patrons and two after the last two patrons, so I thought I'd get them out of the way so you can have all of your bills run consecutively. So you will have them in order: Senate Bill 1147, Senate Bill 1190, and then Senate Bill 1191.
That's correct.
So you're going to be there for a couple of minutes.
I'm sorry.
I said, so you will be there for a couple of minutes.
Okay, that's good. I'm ready.
Thank you.
That's good. So I'll start with 1147, if that's okay.
That's perfect. Thank you.
And this bill is simply a nurse loan repayment program. It came out of a work study that we spent a long time on over the summer. That was the result of the nursing home staffing bill that was here last session. That did not pass, but we focused a lot on recruitment and retention issues for nurses in general, but specifically looking at who is staffing our long-term care facilities. So CNAs provide a significant amount of that care. This nurse loan repayment program simply expands who is eligible for that loan repayment program. Currently in the Commonwealth of Virginia, it's only registered nurses and LPNs. So this bill simply expands that so that CNAs can also be eligible for that funding, which is already in place through the Department of Health. And I believe we have Scott Johnson here to speak in support.
Johnson? Scott Johnson?
Rep. Johnson?
Good morning, Madam Chairman. It's Scott Johnson. I'm speaking on behalf of the Virginia Healthcare Association.
Good morning,
We very much support this bill. A lot of our workforce or CNAs, a vital part to caring for the elderly, and we thank you for your time.
Thank you for yours also, Scott. I appreciate that. Questions from any member of the committee? Hearing none, I'd like to entertain a motion.
Move to report.
It has been moved and properly supported that the bill be reported. All in favor, please.
Madam Chair,
Senator Barker.
the first part of this talks about,
Senator Barker, could you turn your mic on, please?
turn my mic on what?
Oh, okay, sorry.
All right. Yeah, the first part of this bill does talk about such funds as are appropriated. Does this bill need to go to Finance and Appropriations? So then I'll make
I may adjust my motion to report and re-refer to Finance.
Right.
Senator Hall has restated her motion to report and re-refer to Finance, and I did hear a second. All in favor of that motion, please designate electronically.
Senator Lewis?
Senator Lewis votes aye.
Ayes 13, no zeros, one abstention.
Ayes 13, no zero. The bill is reported and re-referred to Senate Finance. Thank you. Senator Kiggins, you now have Senate Bill 1190.
Thank you, Madam Chair. So Senate Bill 1190 is perhaps the shortest bill in the history of my time in the Senate, at least. It's a two-line bill which simply includes advanced directive education in the curriculum framework for the health standards of learning for high school students. So it begins the discussion about advanced directives much earlier. Advanced directives is a written statement of a person's wishes regarding medical treatment to ensure a person's wishes are carried out if a person is unconscious or incapacitated. It allows for patient choice. It's a bill that addresses end-of-life discussions. As a primary care provider, I spend a lot of time just talking to my patients about advance directives. Do you have an advance directives? We're actually incentivized as primary care providers to have these discussions. You could argue that it saves healthcare costs in the future because it prevents people from being on the machines that they don't want to be on, that extends their lives in a poor quality of life for much longer. So it's an important discussion to have, but when I have these discussions, people are very hesitant and they don't understand what advance directives are. They think why are we talking about end-of-life issues? What do you know that I don't know? So it's really important that we start this discussion just much earlier, and high school is just a captivated audience that we have to begin to talk about, you have a choice in the end-of-life care. What do you want? What are your wishes? But put those down on paper, because if they're not on paper, then the physicians and providers in the hospitals don't know what to do, and a lot of times there's a lot of arguments and just family involved, and it would be so much more simpler if we just had your wishes written out on paper. So that's simply what this bill does, is just there's no cost to it. It just includes that in the health curriculum for high school students. And I know we have Dr. Castillo, who is the head of geriatrics at EVMS, to speak in support of the bill.
Thank you, Senator Kiggins. Dr. Castillo? Dr. Castillo online?
Hi, good morning. Are you all able to hear me?
Yes, we're able to hear you very well. Good morning.
Good morning. I'm sorry for the technical issues here.
Not a problem.
Good morning, Madam Chair, committee. Thank you so much for the time. My name is Marisa Galicia Castillo. I'm currently the director of the Glennon Center for Geriatrics and Gerontology, as well as the section head for palliative medicine at Eastern Virginia Medical School. And I'm speaking as a physician caring for patients who have serious illness, or patients in general. As Senator Kiggins mentioned, advanced care plans are actually the ultimate tool for autonomy. With this document, you can select a person that can speak on your behalf when you're not able to, and also to document and express your goals, values, and preferences in life. Currently in our community, only about 20 to 30% of adults have advanced care plans. They are helpful to us as physicians to understand folks' preferences, so we're able to make medical recommendations that really best fit their situations. In my role as an educator, I have given lectures to senior high school students in bioethics classes about advanced directives and advanced care plans. And I have to say, it was quite refreshing to hear from the students themselves. They were wondering, why don't we learn about this at all, because it seems very important. So out of the mouths of babes. So having these discussions earlier, as Senator Kiggins mentioned, is extremely important. In my practice with seriously ill people, I've found that people who do have advanced care plans or advanced directives have a course that's typically smoother, especially at end of life, which is clearly a stressful time. And I will have to say, with COVID-19, that has really magnified this whole process. So completion of the document itself is not as important as the actual conversations and the discussions with a person, with their trusted loved ones. Otherwise, oftentimes we see in practice, I have no idea what they would have wanted. And there's so much guilt, there's so much confusion, there's so much fear that occur because people just don't know, they've never had the conversations. So starting these discussions earlier on, especially with our newest adults, I have to say, talking to folks who are a little bit older, more seasoned, it's much more difficult to have those conversations because they're just not comfortable with it. And starting those conversations earlier really, I think, will impact our community and help not only our newest members of our society, but they can also help shepherd along our grandparents, parents, those who also need the advanced care plans, because again, right now, only about 20% to 30% of people even have one. Thank you.
Oh, you're so very welcome. Any questions of the speaker? Any questions of the patron? I'd like to entertain a
Move to
motion.
report, Madam Chairman.
It's been moved by Senator Cosgrove, and I did hear second. Second. that the bill be recommended for reporting. All in favor, please designate electronically.
Senator Lewis?
This is Senator Lewis. Senator Lewis votes aye.
Ayes 11, noes 3.
Ayes 11, noes 3. The bill is recommended for reporting. Senator Kiggins, you have one more bill, Senate Bill 1191.
Madam Chair, so Senate Bill 1191 is the school nurse bill. We've seen this bill before. We talked about it extensively in special session. It's back because the importance of school nurses has not gone away. School nurses have proven to become more instrumental in the process of actually getting our kids back in school safely. Just yesterday on the front page of the Richmond Times-Dispatch, school nurses right there in the upper or lower left-hand corner about how important they were at administering the vaccine to all school employees. And I think we've all had discussions just about the importance of getting vaccine and the shortages of providers to do that. So school nurses are just a critical component of getting all school employees vaccinated. It's also having a school nurse, as we discussed before, is an important piece of just addressing our healthcare inequities with our lower income schools and students. This is having a healthcare provider in place in the building where all kids go. So having somebody to look out for their healthcare needs there. I wanted to share a personal story just about my children who have been fortunate enough to be in school since August. And the reason my kids are in school is because we've hired school nurses at the two different schools that my children attend. And in speaking to the school nurses preparing to come today and just asking them, their role and what they are doing on a daily basis, these nurses are answering their phones 24/7. They've not only been instrumental in screening and tracking and tracing and quarantining kids who are symptomatic, but they also are putting in place allergy plans and diabetes management plans, and they have one student with epilepsy. They've been working closely with EMS to be able to keep that student in school so that they can just have someone manage their health care when needed. They're just a critical piece. That we would not be in school without them. There was a student who had tested positive for coronavirus and was in contact with 30 other seniors. The nurse had to call all 30 parents, including my son. We stayed home for 2 weeks in quarantine and did virtual school, and then she followed up. But they're just instrumental in that tracking and tracing. A school secretary cannot do these things. Another school employee cannot. So having that one dedicated person to address all of those issues. But I think we can all agree we want our kids back in school safely. So I cannot overstress the need. And I know there's a cost to this, and I know this may not happen tomorrow, but God forbid we have something like this happen again. So having that healthcare provider in place to do all of those things I mentioned, but now moving forward, just giving that vaccine as well. So my bill also has a waiver for LPNs. I know there's some debate, and the bill actually talks about having a registered nurse in all schools just to be able to do that assessment and initial treatment, and I agree that that's a great goal. But I also know that there are LPNs out there providing care. We do have somewhat of a nursing shortage. So there's a waiver process. I'm not trying to have LPNs just brushed aside for right now. I want to be inclusive of them and just make sure we have one school nurse in every school. I know we have several people to speak to this bill as well.
Madam Chair.
Please designate electronically. I can hear your voice, Senator Peterson.
Oh, I'm sorry.
But I need you to. Otherwise, I'm going to feel like a bobblehead. Senator Peterson?
Yeah, Madam Chair, I'm sorry. I did press the request to speak, but maybe it's not coming through up there.
Yes.
I assume this has a fiscal impact on our localities. Is that listed anywhere? Do we know what that number is?
So there's some debate about the fiscal impact, and it's the same debate that we had during special session, and we got 3 different ones. Honestly, and I'm not unrealistic about, I know that there's a funding issue.
Right.
There's also a lot of unanswered questions, because some localities do a great job. Virginia Beach, we do have a school nurse in every school, but I know that's not the case in all of Virginia. So, just realistically speaking, it's an important issue. I would love to see it, pass and go to finance, but I also am open to things like work study. I saw some great outcomes from our nursing home, but it just, the issue cannot go away, and the issue needs to be explored into how we can get this done.
Thanks. Thank you,
Further
Madam
questions, Senator Peterson?
No, ma'am.
Any questions? Other questions of the patron? Senator Cosgrove?
Thank you, Madam Chairman. I am in the queue. My concern is that basically the bill specifically calls out the requirement for a registered nurse. And we do know that registered nurses are in short supply at this time. So I would be more comfortable with the bill if it did not call out specifically registered nurses, but also allowed LPNs or other nursing healthcare providers to be able to do this in the schools. My mother was a registered nurse, and I know dealing with my local hospital, there is a vast shortage of registered nurses. So I guess I'd ask the patient, the patron, would she be more comfortable putting in just a licensed nurse provider, vice chair, registered nurse for this bill?
So the School Nurses Association has been very, their ask is for a registered nurse, and I understand that, registered nurses provide a different level of nursing. I guess they're, more educated and that type of thing, but I hear you and I agree with you, and there are LPNs in place that are doing a great job. That's why we have in my bill, and I think there's different versions out there from the House, but my bill has a waiver process for if you have an LPN in place, or if it's an undue hardship, I believe is how the bill reads, then an LPN will suffice in that position. So I agree with you that there are other certified nurses that can perform this role, but that with the goal of having a registered nurse in that position, I think would be the best fit. But you are not incorrect in what you just said about nursing shortages, et cetera.
All right, thank you.
Thank you, Senator Cosgrove. Senator Kiggins, you want to wrap it up?
I'm sorry?
Are there any other speakers of the patron? Any other questions of the patron?
We have several speakers.
Madam Chair, Senator Barker.
Senator Barker?
Yeah, Senator Kiggins, a quick question for you on lines 135 and 136 is where it references the waiver process, and it limits the waiver process to the requirements of this subsection being an undue hardship, which I think if we hadn't been involved in the discussion with you, I think a lot of us would have interpreted that mean they would be exempt from the requirement to have a nurse, not that it would be an LPN rather than an RN.
So we are meaning for that to say it can be an LPN and not an RN. If there's an undue hardship, meaning a shortage or the availability of a registered nurse just isn't there, then the LPN would suffice in that position instead of a registered nurse. Not that you don't have a nurse at all.
Right. But I think that if that's what your intent is, it would be helpful to spell that out, because to tell you the truth, if I had not heard the discussion, I would have interpreted this to mean you would be exempt from the requirement to having a nurse.
So some wording clarification. Okay. Thank you.
Thank you, Senator Barker. We have speakers online. I have several. Shane Riddle, the first speaker.
Good morning, Madam Chair.
Good morning.
Good morning. Thank you for the opportunity to speak, Madam Chair, to Senate Bill 1191. The VEA, I'm Shane Riddle. I'm the interim Director of Government Relations for the Virginia Education Association. The VEA joins the position of the National Association of School Nurses and other groups that every child has access all day, every day to a full-time registered professional nurse. The school nurse addresses the physical, mental, emotional, and social health needs of students and supports their achievement in the learning process. And we appreciate that Senate Bill 1191 does three primary things. Number one, it provides a full-time equivalent school nurse position in each elementary school, middle school, and high school. And secondly, it defines what that school nurse is, which we do adamantly support. And then in lines 135 and 136, it establishes the waiver process that was talked about earlier. And so these are the things that we feel like are primary things where we can support Senate Bill 1191 and encourage the committee to move forward favorably on the passage of this legislation out of the committee. Thank you very much.
Thank you very much. I see that all of those speakers that were in the queue have obviously entered the room. Asha Kedar is in the room.
Yes. Good morning.
Good
My
morning.
name is Dr. Yes. Good morning. My name is Dr. Archival Kader. I'm speaking on behalf of the Virginia chapter of the American Academy of Pediatrics. We support Senate Bill 1191 because we recognize the important role that school nurses play in promoting the optimal biopsychosocial health and well-being of our children in the school setting. Now, in the midst of a pandemic, the need for this is even more urgent. As school divisions contemplate the appropriate circumstances for students to return to in-person education, COVID-19 has revealed myriad gaps in our healthcare system. And the absence of school nurses is yet another example of a disparity affecting our children. As pediatricians, we strongly support the work of our nursing colleagues and the vital role they play in mitigating the impact of this pandemic on our children and their communities. Thanks.
Thank you very much. Catherine Haynes? Catherine, you're muted. We can't hear you. Catherine, you are muted.
Hello?
I can hear you now.
Matt? Oh dear. Can you help me unmute?
You are unmuted now.
Oh no.
We can hear you.
I took off my thing. I don't know what to do. I'm here. They're not working. I took them out for a second.
We can hear you.
Is it this help with it? Can you hear me now?
Catherine, we'll come back to you while you work on your technology. We would go now to Emily Griffey.
Good morning, Madam Chair and members of the committee. I'm Emily Griffey, the Chief Policy Officer at Voices for Virginia's Children. As we've seen during the pandemic, child well-being and health is critically important to their success in school. This bill helps to provide equitable access to school nurses for all children across the state, and we support this legislation.
Thank you. Jenna Alexander.
Good morning. Thank you for the opportunity to speak with you today. My name is Jenna Alexander. I'm the Vice President of Advocacy for the Virginia PTA. I'm here today to speak on behalf of our 175,000 members across 950 of Virginia's public schools in support of this bill. We've been talking about having a registered school nurse in buildings for the past 27 years. And rather than repeat to you the same things that I shared with you back in special session and that you already know the advantages provide, I wanted to share a personal example of what happens in my daughter's elementary school. So she's in one of Virginia's 275 schools that has less than 299 students. And according to the enacted standards of quality, her building is staffed with a part-time principal, no assistant principal, a part-time librarian, a part-time technology teacher, a part-time counselor, and there's no standard for health aide or a nurse. Now, the county does staff a full-time principal because not having somebody there in the building all day long is an egregious failure on behalf of the safety and academic success of our students. And we do have a health aide. But the thing is, there's 25% of students, according to the CDC, have chronic health concerns. I've been in the building, and the PTA role, you often find yourself in the building in unusual cases. And I've seen students come into the office in diabetic distress to get inhalers.
Jenna, I'm sorry, I hate to interrupt you, but we had 3 minutes for each side, and the time the time for the opponents has expired.
Oh.
I mean, proponents, I'm sorry, time for the proponents has expired. But because we were having a little bit of technical difficulty, I'd like to go back to Catherine. And even though we're expired to hear her for a couple of seconds.
Sure.
Catherine,
Can you hear me now?
I can hear you. Can you hear us?
Yes. Thank
Okay, you have
goodness.
only a few seconds left because the time
Okay,
for the,
Catherine Haynes, Chesterfield County Public School Board, in strong support of this bill, cannot open schools in a pandemic without a nurse in every school. I would like to see nurses added to the state SOQ, and I'm on this morning because passionate constituents called me early this morning, so I just found out about it before, before the meeting started.
well, I
That
thank
shows
you
the
for
passion
signing.
of our
I
constituents.
thank you for signing up to speak. Thank you very much.
And thanks, Senator Kiggins.
Okay. I'm sorry, maybe a lot of the speakers were not aware that we had 3 minutes for the proponents and the opponents of the bill. And so at this point, if there are no other questions of members of the committee, I'd like to entertain a motion, but this bill is slated to go to finance, so.
Madam Chair, if I may really quickly, I want to clarify whether the intent of the committee was to adopt an amendment with clarifying language around the waiver process and LPNs. I don't think we adopted what Senator Barker brought up, so I just wanted to clarify whether that was the intent.
Senator Barker?
I don't have any specific language, but be happy to work with Senator Kiggins to come up with language. But I think that the intent is to have that waiver process apply to a LPN rather than an RN, rather than not having a nurse in school.
That's correct.
Madam Chair, I think that can be adopted in concept, and we will get the language correct before it goes to the floor.
Thanks. Thank you very much. Council will take care of that. I just want to, just for the record, to note, Tom Smith has a hand raised, Stacy Haney has a hand raised, and Angela Moore has a hand raised. And I'd just like to record those who are in favor and those who are opposed. If I bring the screen up for just a few seconds, I'd just like for you just to indicate your position on the bill. Angela Moore.
So I don't know if I'm going first or whatnot, but I'll be happy to. My name's Angela Moore, and I am definitely in favor of the bill. I'm the president-elect for the Virginia Association of School Nurses.
Thank you very much.
I move the bill be reported and referred to finance.
I hear a motion that the bill be, Senator. As amended. Senator Saslaw's motion is that the bill be reported as amended and be referred to Senate Finance, and I hear a second from Senator Howell.
Madam.
Just a second, Senator Peterson, I'll get right with you. Senator Saslaw, did your motion include a motion for the amendment?
Sure.
Okay, can you restate that for me, please?
All right, I move as amended that the bill be reported and referred to finance.
Okay.
Madam
Bill
Chair.
is amended to be reported and be referred to Finance, and Senator Howell is the second.
Madam Chair.
Senator Peterson.
Your parliamentary inquiry, do we actually amend this? I didn't.
We did not.
We did not.
Oh.
Can somebody report the amendment?
They were going to work on it.
It's a concept?
Okay, then I need to have a motion for the amendment in concept, I guess this week.
I'm happy to move the amendment in concept. I guess it's to expand the criteria to include LPNs, is that correct?
To have a waiver process for LPNs that would be based upon hardship.
Okay, I'll make that motion.
Okay, all right. I thought that was a motion that Senator Barker had made earlier, or maybe he just spoke to it.
Madam Chairman.
Okay, we have a motion on the floor. Sorry about that. There's a motion on the floor. Senator Peterson.
Second on that motion.
Senator Peterson.
Your hand is up on the screen.
Senator Cosgrove.
Thank you, Madam Chairman. I'm a little reticent to support this amendment in concept Basically, what we're looking at, the body of the bill requires a registered nurse, okay? Registered nurses are in short supply. They're being paid very well in competing different hospitals to have that work done. I believe that this bill should not basically say it's a registered nurse or you get a hardship. It should just include RPNs and LPNs as nurses who are eligible to fill this requirement. I think we're going to be putting a lot more on our local governments to establish a, quote, hardship. And that's my only concern about that. I just believe that LPN should be part of this, the body of the bill.
Thank you, Senator Saslow. Senator Donovan.
Madam Chairman, just to speak to the bill, I will point out that there is a large contingency of nurses who love to be school nurses, and it's not exactly an apples-to-apples competition with hospitals. And the reason that it's not is, one of the wonderful things about nursing, having been one, is that you can do lots of different things. It's a very mobile credential that you have. So when you're a school nurse, there's obviously the reward of taking care of the children, but you also have a nice schedule. And so registered nurses actually are, when you have only one provider in the school, to have the level of registered nurse is a benchmark we should aspire to achieve. And I think that there needs to be exceptions for that for a multitude of reasons. But I actually am in support of the language as proposed by Senator Barker, because this is an adjunct that is important as the hinge that's going to connect healthcare outside of the school to the schools. And, RNs have a lot of experience with that. So for all of those reasons, and I have a second comment, Madam Chairman, I'm not sure that I'm right on this or not, but I thought there were two other people that were waiting to speak in favor or not when you looked in the room. And I just want to advocate for people who are in the room to be able to speak, because I know this is confusing for us and it's confusing for them. But if there is somebody else that's supposed to say yay or nay, I hope we'd give them that chance.
There's only one hand still raised, and that's Ann Gill. And I asked earlier for those persons who want to be recorded in favor of the bill to have a raised hand, and those who are opposed likewise, and I only saw the one hand.
There's a motion before us.
I think there may be a second hand. I just want to make sure that they're recorded as being either in support. Okay, I have Angela Moore with a raised hand, and then Ann Gill. Those were the only two with raised hands. And I'd like for them to either have a show of hands, designate if they're either in support of the bill or opposed to the bill. I just want everybody who has an interest in the bill to be recorded one way or another.
Madam Chair, I think Angela Moore already spoke, but the other one
Yes,
did not.
but she has a raised. I just want them to be recorded as being in favor, but the hand is still raised. And Andrew Lamar and Ann Gill. Ann Gill in favor? Ann Gill is yes. Please report Ann Gill as being in favor of the bill. Angela
Yes, Madam
Moore.
Chair, the Virginia Nurses Association strongly supports the bill. Thank you very much, and
Andrew
appreciate
Lamar
Senator
in
Donovan's
support of the
comment.
bill. Stacey Haney.
Yes, Madam Chair, Stacey Haney with the Virginia School Board Association. We have serious concerns with the bill, Madam Chair. We don't dispute the value of the school nurses, but with the nursing shortage that's going on, which does extend to LPNs as well as RNs, we don't think that this is the way to solve the problem. We think the solution to the problem would be to increase the pool of nurses that could serve on our school divisions through programs that are institutions of higher education. But to mandate that schools do something which we all know is not currently possible just doesn't make sense right now.
Thank you, Stacey Haney. We will have you as recorded in opposition to the bill. Is that correct? Yes. And Ann Gill, of course, you have a raised hand, and we have you recorded as being in favor of the bill. Tom Smith, we have your hand.
Am I able to talk?
No, your time has expired for those who are in support of the bill. Tom Smith. Tom Smith, your hand raised in support of the bill or in opposition?
Madam Chair, Tom Smith of the Superintendent's Association.
Yes.
Madam Chair, Tom Smith of the Superintendent's Association. We share the same concerns as Ms. Naney of the School Board Association.
Thank you. So we have you recorded in opposition to the bill.
So this is Angela Moore. Can I just ask a question rather than give a comment?
Angela Moore?
Correct, yes.
We've already heard from her half
Yes.
a dozen times.
No, I mean, yes, I am in favor. Could I just ask a question before it goes to the next? Would it be helpful if we gathered information for you on the legalities of who is allowed to provide which type of services?
No, we've already gotten all of the testimony. We have to now move to have the bill reported and be referred to finance. I think that was the motion was that the substitute.
Okay.
Okay.
My concerns are that LPNs cannot do many things.
I'm sorry.
So if we don't have LPNs, they're
I'm
not
sorry.
gonna be
Your
able to
time
do
has
it.
expired for speaking speaking to the bill.
Why don't we just vote?
As soon as I just repeated your motion.
Madam Chair,
Senator Newman.
I think I'm in the queue. Speaking to the motion,
Senator Newman.
Madam Chair, I'm not going to support the motion, and here's why. We've sent it to Finance many times. It is a fantastic idea. But you're going to tell people in Bedford County who have very small school divisions how to run their schools, where they have a school nurse now that's able to serve multiple schools. And that's why I can't support it, and why Senate Finance has defeated it in the past. It's a great idea. I think Senator Kiggins has got a great idea. It's not in her area, it's in our area. And I think our local school division people can determine how to manage their personnel really well without Richmond telling them how to do it.
Madam Chair.
Madam Chair.
Let me see.
Do I have a
I heard
closing?
Senator Howell, and then we'll go back to you, Senator Kiggins. Senator Howell.
Earlier, I heard Senator Kiggins suggest a work group to work on this. I thought that I've been mulling that over since she said it, and I think it's a really helpful suggestion. And I hope we will refer it to finance, and we will be able to put through the budget in a work group, because this has been going on my whole career. We've made no progress, and yet it's a very urgent need. So I hope we will report and refer to finance.
Okay, there is a motion on the floor, and I know that there are other hands raised, but the time has expired for those persons who want to speak in favor of the bill. I'm sorry, your time has expired, so now we will move forward with the motion. All in favor of the motion made by Senator Saslaw and second by Senator Howell, please designate electronically.
Senator Lewis?
Senator Lewis votes aye.
12 ayes, 1 no, abstentions 1.
Yeas 12, nays 1, abstention 1. The bill as amended, or the substitute, will be reported and be referred to finance.
Thank you, Madam Chair.
Thank you, Senator Kiggins, for your time this morning. Senator Locke is the next patron up. And Senator Locke, when you, I thought I saw Senator Locke.
She was here, but she left. She left. She's not here. She will get, will be.
Okay, Senator Peake is up next. Senator Peake, Senate Bill 1235. If you could please join us here at the lectern in the front of the room. Yes.
What am I supposed to do?
Here. All things considered, with the technology, I think we're still doing quite well. This is our first attempt at it. Senator Peake.
Yes, thank you, Madam Chair. This is Senate Bill 1235, a pretty straightforward bill that we discussed in this. Oh, thank you. I'm sorry. That we discussed in the special session as well. And it arises out of a bill from the Department of Health, which created, in essence, a sex text hotline that allows our students to call in, and then they may be contacted by the Virginia Department of Health, by local authorities, or by a third-party group. The Department of Health actually contracted with a third-party group that may contact students and ask them or have discussions about very explicit sexual matters. And this bill would mean that they cannot do that unless they have parental consent. And that's consistent with what we have in several other things in the Department of Education or dealing with our youth. For student school pickup at our public schools, they have to have parental consent to allow someone else to pick them up. For family life education, they have to have parental consent. For custodial interrogation, they have to have parental consent. So this is really just a basic parental rights bill that would prohibit their children from talking with strangers about very private, intimate sexual matters. So then that is it, and we have several people lined up to speak in favor.
Senator Peake, you said you have several people lined up to speak, and I only see two. And I'd like to first call on Jeff Caruso. And next will be Eileen Roberts. Jeff Caruso.
Thank you, Madam Chair. We stand in support of this legislation. Parents are the first educators of their children and also those who are primarily responsible for making healthcare decisions. Whatever one's views are of the program itself that Senator Peake described, we think there ought to be consensus that parental involvement is a good thing and something that ought to be required as these programs continue to be implemented. Thank you very much for your time.
I thank you so very much for yours. The next speaker that we have in queue is Todd Gaethe.
Madam Chair, members of the committee, good morning. I'm Todd Gaethe, Director of Government Relations for the Family Foundation, here to speak in support of Senate Bill 1235. I think as a parent, I have 4 kids, and on behalf of tens of thousands of parents in Virginia, there's nothing more frightening than not knowing the whereabouts of your child or having them have conversations with people who you are not familiar with. And quite frankly, there are a lot of bad actors out there. And so it's equally frightening if government intervenes as well and facilitates conversations with our children without our parents even knowing and their consent. This is reflected in recent polling with the Mason-Dixon poll. Significant majority of people are concerned about this issue. So we just want to encourage and urge this body to support this bill. Parental knowledge and consent is foundational to our society. And we don't want to create any wedge that violates that special bond between parents and children. As the patron mentioned, there are places where parental knowledge and consent is important, whether it's knowing who's picking your kids up from school or curriculum or other areas. And so we just want to urge this body, please support this bill and support the ability for parents to maintain a special bond with their kids. Thank you.
Thank you so very much. Senator Peake, unless I'm mistaken, I'm looking at the electronic device, and I have one more speaker for you. Eileen Roberts.
Yes, can you hear me?
Yes, I can hear you very well.
So my name is Eileen Roberts. I'm the founder of Parents for Life. I support Senate Bill 1235 because parents are the only ones who should be responsible for their children's medical care. More importantly, parents, not strangers, are responsible for follow-up care, especially in the case of emergencies arising from mistreated health care. So I urge you all to please protect parents and families and support this bill by Senator Peake. Thank you.
Thank you so very much for joining us this morning. Senator Peake, I see no more raised hands, so I'm back to you.
All right. If there are no questions, I'll just reiterate this. And Senator Newman had the flyer, which I don't have, which was a very explicit flyer that was passed out. He had it during the special session about the topics that would be discussed. I'm sorry.
No, I'm sorry, I just saw Olivia Turner in the queue, but go right ahead. I'll come back to Olivia.
And it's a recent creation, this text line or talk line. And I think we just need to add parental consent to this to make sure people are not contacting our underage kids and talking about these topics without parental consent.
Thank you. I see Olivia Turner in queue. Olivia, you're speaking in support of the bill?
Yes, ma'am, I am.
Okay.
Very quickly, Virginia Society for Human Life supports this bill because, as you know, as all the members of the committee know, there is a parental consent law in Virginia regarding the issue of abortion. This is simply a protective measure, we think at the SHL, that expands and expounds on what may be a questionable scenario when strangers are talking to our teenagers, to our minor age daughters, without understanding the laws in Virginia and thereby potentially disrespecting those laws and placing our minor age daughters in jeopardy. So we do support this bill. We applaud Senator Peake for introducing it, and we hope that this sort of action will also apply to perhaps other healthcare issues, possibly even ones discussed in a previous piece of legislation by Senator Keegan's.
Thank you so much for your comments.
Thank you.
Thank you.
Madam Chairman,
Senator Cosgrove.
I would move to report the bill.
Madam Chair.
Madam Chair.
Madam Chair.
I hear voices. I think I hear
Senator Hashmi.
And then I heard Senator Peterson.
Yes, ma'am.
Yes, Senator Hashmi and Senator Peterson.
Thank you. Just a quick question for the chair first, but are you able to see us if we're in queue, if we press the button? I'm just curious if you're able to see that.
I am just this moment able to see 5 people in queue,
Okay.
4 people in queue, but I see you now.
Okay, thank you.
No, I don't see you. Now I see you, now I don't. Now I see you.
Okay. I just
Now I
wanted to
don't.
I wanted to clarify that procedure, but I do have a couple of questions for Senator, for the patron. A couple of questions, Senator Peake. The bill speaks to parents, but what are the allowances made for those children, those minors who are in guardian custodial situations? And then secondly, would your bill impede a minor who is seeking to have birth control and other services provided to her if she is seeking those services without a parental consent, such as birth control especially?
Senator Peake.
Yes, Madam Chair. First, I would be happy to add parent or guardian to the bill, to one to give consent. And as to whether it would not impede, this hotline is just for people to call in and talk about that we're talking about sexual activities. I do not believe it would impede, but I also state that a minor should have parental consent when they're getting medical treatment. You can't get anything without parental consent when you're a minor. So,
Madam Chairman,
Senator Donovan.
I can answer that question if you
Senator
like.
Donovan. The floor.
Senator, Madam Chairman and Senator Hashmi, in Virginia, minors have emancipation for reproductive rights and birth control, so it would not interfere with that.
thank you, Dr. Donovan.
I think Senator Peterson's next.
Madam Chair, I had a question for the senator from Lynchburg, if I might.
You have the floor, Senator Peterson.
Okay. Senator Peake, I guess my question is, and I'm taking my mask off, I'm looking at this language, and I understand your specific situation. This language is pretty broad, and Department of Health, one of the things they've been doing is contact tracing. So if there's a COVID outbreak and maybe it came from a high school gathering or a high school party, and they need to talk to these kids and figure out who they talked to and interacted with. How do we weave that in, this idea that anytime you talk to a child, you got to get the parental consent?
And now, my LIS is not coming up, but in the bill, we're talking about those specific natures. We're not talking about the healthcare of contact tracing, but again, in my actual, it's very simple, straightforward paragraph, and I can't pull it up now, but if the school or the Virginia Department of Health thinks that someone has been exposed to the coronavirus, then I think the parents should know. They should contact the parent, say, we need to talk to your child. We think they've been exposed to the coronavirus by someone at school. It would make perfect sense. I don't see that being a problem.
Well, if I might follow up, Madam Chair.
Senator Peterson?
I'm not saying it's necessarily a problem, and certainly the ideal would be you go through the parents and guardians, but again, where VDH is investigating an outbreak of COVID or any other communicable disease, they're not practicing medicine, but they're simply just trying to obtain information about where people were. I don't know. It just seems to me it may make that a very cumbersome process. But maybe that's the process right now. I don't know.
Yeah.
Madam Chair.
Senator Newman.
I'm sorry, I am in the queue, but I think there are a couple of questions that are brought up today that don't go to the fundamental desire of the bill, but are legitimate. I think it needs to have standing in loco parentis, as Senator Hashmi indicated. I think that the item from Senator from Fairfax is exactly right, too, that it's going after a very specific item. I would like to ask, Madam Chair, if you agree that the bill go by for the day and that the committee can make a decision based on what the real content of the bill is, which I think is, to me, somewhat concerning, but I think the writing of the current bill can be greatly enhanced with one more day.
Without objection, the bill will go by for the day.
Yes.
Thank you, Senator Peake. Senator Locke, you have two bills on the docket for today. Please start with Senate Bill 1102, and that's the Department of Medical Assistance Services Personal Care Aid, the orientation program, to be followed by Senate Bill 1196, teacher and other licensed school board employees. Senator Locke.
Thank you, Madam Chair, and I am without glasses, so I will give this my best shot. In 2019, DMAS used existing funds to launch an orientation program for consumer direct home care workers with the support of the Northam administration in order to improve recruitment and retention and improve the quality of care. Senate Bill 1102 simply seeks to codify quarterly regional in-person orientation for care workers and Medicaid consumers. The orientation program will cover operational procedure and record keeping. These home care workers fall into a gray area. Despite being compensated through state Medicaid dollars, the state is not their employer. The Medicaid member hires their home care worker, and the state works with a third-party fiscal intermediary to process payroll and provide other typical employer function. Numerous states, including Pennsylvania, provide orientation programs for consumer-directed home care workers. The orientation program would be implemented to achieve greater efficiency in processing paperwork and ensuring program requirements are met. This small investment.
Senator Locke, hold a second. I hear some background noise here. Senator Locke.
This small investment in workforce development can have substantial benefits like reducing turnover, eliminating costly and time-consuming errors, reducing fraud, and improving the overall quality of care. Codifying an orientation is both an economic and racial justice issue which will help establish home care workers as the essential health care professionals that they are. And that's the essence of this bill.
Thank you, Senator Locke. I have a David Broder in queue, and Maureen Hollowell, Lucy Bednell, and Julia Newton, and we will take them in that order. Committee clerk, if you will assist us with that. First speaker.
Thank you, Madam Chair. Sorry, I just got the audio. Are you asking me to go first?
Yes, I am.
Wonderful. Thank you so much, Madam Chair and members of the committee. My name is David Broder. I'm proud to serve as the president of SEIU Virginia 512, representing essential home care and public service workers. I'm here to testify in support of SB 1102, Senator Locke's bill to ensure an orientation program for consumer-directed home care workers, and I'll be very brief. Home care workers, as you know, are on the front lines of the pandemic, keeping older adults and people with disabilities healthy and safe and out of nursing homes at this critical times. And yet these essential heroes face challenges, including the low pay, lack of benefits, and lack of basic information about their job. Who to turn to for a paycheck issue, what state programs and trainings are available to them. By establishing an orientation where they and their consumers could get basic information about how their programs and jobs work, we can improve recruitment and retention of this vital workforce and improve the quality of care for older adults, people with disabilities, and their families. Thank you very much.
Thank you so much for your comments. Next speaker.
Good morning, Madam Chair and committee members. My name is Maureen Hollowell, and I'm representing the Virginia Association of Centers for Independent Living. Senate Bill 1102 addresses Medicaid consumer-directed employment. This bill would be a tremendous enhancement to the work that's being done now. These vital consumer-directed employees provide support to people with disabilities who use Medicaid consumer-directed supports either through Medicaid Works, early and periodic screening, diagnosis, and treatment, EPSDT, and the Medicaid's community waivers. And providing the information that this bill outlines and through an orientation and annual orientation really would help to ensure that the person with the disability who's doing the hiring and the consumer-directed employee have the needed information so that employees receive their pay in a timely manner and the other benefits that they need. This also will help the person with the disability who provides information on the front end provide the same information that they're hearing from the fiscal agents who actually pay the salaries for the employees, to try to make sure that we're all providing the same important information in a timely manner. Thank you.
Thank you so much for your comment. Next speaker.
Thank you, Madam Chair. My name is Lucy Beednell. I'm speaking on behalf of the ARC of Northern Virginia, and we are strongly in support of SB 1102. A significant portion of our small staff team work as support coordinators that help families and individuals who recently received the waiver navigate services. I myself had that job for a number of years, and I can tell you it is incredibly stressful to tell a family who's waited 10 or 20 years for a Medicaid waiver, finally got one because they're in crisis, that all of a sudden they're the sole employer and they've got to train, they've got to become an HR department, they have to understand paperwork, and they've got to get it done, or the attendants that they work so hard to hire are going to leave because they aren't getting paid. We are incredibly supportive of this bill that would give a little bit of relief to people with disabilities and their families by way of offering some supports to them at a really critical juncture in hiring care attendants, and also make the job easier for care attendants. I can't tell you, there hasn't been a day in my dozen years at the ARC when I haven't heard complaints about how care attendants turn over so quickly. And a significant part of the reason is they're not well supported. This really gets to that issue, and I think would prevent people with disabilities and their families from throwing up their hands with consumer-directed services and instead opting to select more restrictive, more expensive services that offer them reduced burden. Thanks so much.
Thank you so much. We're over time, but I'm still going to hear from I think we have one more speaker in the queue. Speaking in favor of the bill?
Yes.
Good morning. This is Julia Newton. I'm a member of STIU Virginia 512, a PCA, and also a mother with a child with disability. Orientation sets the standards of expectations of duty. When the state switched over to the EVV system, a lot of PCAs quit because they didn't get paid. A lot of employees of records did not know, how to navigate the system, and it was just as a mother that hires people myself, it was just a disaster to retain PCAs in a field that's already shorthanded.
Thank you.
Also, orientation will teach that this program could be jeopardized, and also how to advocate for a program that's needed and will save the state thousands of dollars. Orientation will also access workers to the important information that's needed to provide higher standard quality and quality care for the people receiving services.
Thank you, Julie. The time
And proper
for
training always is also orientation will also.
thank you, Julie. The time
Okay.
for the thank you so much for your comments. I really appreciate it. Okay, we gave the those in support time, and I don't see any opposition, but the time has expired for the speakers. I'm so sorry. Any questions of the patron by members of the committee? Senator Donovan, Senator Peake?
Thank you, Madam Chairman. And Senator Lucas, I love the bill. I'm just curious, is there a fiscal impact? There's not one listed, and I am interested.
There is.
There is. Okay.
Senator Peake?
Yes. Question for the patron, Madam Chair.
Senator Locke?
And Senator Locke, I think the very last sentence or two of your presentation, you mentioned racial justice or racial inequality, but this bill, I mean, it applies to everybody of all races, all ethnicities, male, female. I mean, it benefits everyone, doesn't it?
Yes, it does.
All right, thank you.
Any other questions of the patron? Senator Howell?
I move to report and re-refer to finance.
The motion is to report and re-refer to finance,
Second.
and there is a second. So all those in support of reporting and re-referring to Senate Finance, please designate electronically.
Senator Lewis?
This is Senator Lewis. Senator Lewis votes aye.
Senator Locke has a question. Senator Howell has a question.
My apologies, Senator Lewis. What was that?
I'm sorry, I vote aye.
Thank you, sir. Ayes 14, no 0.
Ayes 14, no 0. The bill is reported and re-referred to Senate Finance. Senator Locke, you have now Senate Bill 1196.
Thank you, Madam Chair. Senate Bill 1196 addresses culturally competent Virginia educators. This proposal sets out several new training and professional development requirements that will equip all Virginia educators with the skills necessary to sustain culturally responsive classrooms. This legislation aims to ensure that history and social science teachers have the specific content knowledge to teach African American history with sensitivity and confidence by revising Virginia's guidelines for uniform performance standards and education criteria for teachers, principals, and superintendents to include cultural proficiency efficacy, requiring all current school board employees and every Virginia educator seeking initial licensure or renewal of a license to complete instruction or training in cultural competency by the 2022-2023 school year and every 2 years thereafter, requiring all educators seeking initial licensure or renewal of a license with an endorsement in history, social science, to complete instruction in African American history as prescribed by the Virginia Board of Education, and allocating funding and personnel resources to develop and disseminate comprehensive professional development in the areas of cultural competence, and culturally responsive pedagogy for all Virginia educators. And that, Madam Chair, is the essence of this legislation.
Thank you for that presentation, Senator Locke. And before I go to members of the committee, there are raised hands in the queue, and I'd like to be specific in how we approach this. And as we go along, I'm sure we're going to get better. Those speaking in favor, you have a total of 3 minutes for your side. Those speaking in opposition, you have a total of 3 minutes for your side. I have allowed people to go over on previous bills because I think there may not have been any clarification. I think some speakers thought that they had 3 minutes each. That is not the case. 3 minutes per side. I have, it's like Makla, Little, Josh, Hertzler, Miriam, Bogus, it looks like, Atif Kwani, Shane Riddle, in the queue, in that order. So if you would come forward to speak, if your time has expired, for those speaking in favor or in opposition, I will call the time and let you know that the time has expired, and then all I want the following speakers to say is that they either support or oppose the measure. Thank you very much.
Thank you so much. Good morning. My name is Makia Renee Little, and I served as the parent advocate and HBCU representative on the Virginia African American History Education Commission. According to education and labor research conducted by the RAND Corporation, compared to any other aspect of schooling, teachers have the greatest impact on student achievement. This bill requires educators, in the Commonwealth, not just to be aware of the experiential impact they have on students, but to also be accountable by performance measures. Every student in the Commonwealth deserves culturally competent educators and administrators, as they are key to student performance and success. As a product of Virginia public schools and as a Prince William County parent of 3, I appreciate Senator Mamie Locke for introducing this bill, even without her glasses, and I ask the support of this committee in championing and voting in its favor. Thank you.
Thank you, Ms. Little, for staying within the time. Next speaker.
Madam Chair, this is Shane Riddle with the Virginia Education Association. We stand in support of this bill. Thank you.
Thank you so much, Shane. Maria?
Good morning, Chairman Lucas, members of the committee. My name is Maria Burgos. As a member of the African American History Education Commission and the supervisor of global learning and culturally responsive in Prince William County Schools, I am proud to support the Senate Bill 1196. Virginia has the opportunity to lead the nation with cultural competency practices, policies, and legislation to promote equity and inclusivity, resulting in a quality educational experience that prepares every student in Virginia as stewards of themselves, the community, and the world. The Culturally Competent Virginia Educators Bill aligns with best practices in neuroscience, psychology, sociology, linguistics, and learning. The way that every brain makes sense of the world, regardless of race and ethnicity, is a collective social culture and serves as the primary springboard for deeper learning and the foundation for empowering, noticing, and addressing structures which historically marginalize and oppress Blacks, Indigenous, and people of color in our learning institutions in the Commonwealth. I urge you to support this bill. Thank you.
Thank you very much. Next speaker. Dr. Corney? Who's next?
Good morning, Madam Chair. Thank you so much for letting me speak here. Good morning, members of the committee. Here speaking on behalf of Governor Northam in full support of Senator Locke's bill. This recommendation came as a direct result American History Education Commission established by the governor, which was made up of historians, educators, civil rights leaders, faith leaders, and national experts. So we are in strong support of the bill, and I urge the members of the committee to vote in favor of the bill. Thank you so much.
Thank you very much. Next speaker, John Hessler. Josh?
Oh, yes. Excuse me. Madam Speaker, Josh Hetzer with the Family Foundation, also representing the Founding Freedoms Law Center. And I want to say from the outset that we recognize that Senator Locke is trying to do a very good thing. We believe that cultural competency is important for everyone to exercise and to know about, especially teachers within schools. That being said, we do have some concerns about this term, cultural competency, and believe it could tend towards viewpoint discrimination because the word is so broad. And excuse me, there may be some construction behind me outside. But the word may be so broad that it's very difficult to know how to interpret. One of the things about this bill is that it would include in a teacher's annual evaluation their cultural competency. And so that makes it very challenging as a matter of free speech, free expression, different ideas. And let me just mention one thing that happened this year to give you an example of how this can go wrong. In Loudoun County, just a few months ago, there was a bill, a policy put forward, essentially that would bring critical race theory into the policies, and then it said that teachers were not allowed to speak against it in any way. Well, this created a lot of backlash with the teachers. Even the local VEA chapter came out and opposed this. And the discussion became about, like, teachers need to be able to have some freedom of speech. And I think ideally you could do that and have cultural competency. The challenge is, how do we define that? And so that's really our concern about this bill. So I thank you for considering those concerns.
Thank you for joining us this morning. I want to inquire of staff, of IT staff, if there are any other speakers in queue, because there are none visible on my board. Okay, thank you. Now we'll turn to members of the committee for questions.
Madam Chair.
Senator Newman.
Madam Chair, I guess my question is to staff. Is there anywhere in the code where cultural competency is defined?
Madam Chair, Senator Newman, the term is not defined in code. It is used a few times in Title 2.2 related to training for government employees.
Madam Chair.
Senator Newman, you still have the floor.
Madam Chair, maybe it's to the patron. I think I understand very clearly what 167, 168 is, and supportive of African American history. I'm very much in favor of history being taught, and I think we're losing some of that. Maybe to the patron, what is the general definition of cultural competency if it's not a codified definition?
Repeat that, please.
Yeah, yes, ma'am. What is the general definition of cultural competency if there's not a codified definition of cultural competency?
An understanding of someone else's culture.
Understanding all, Madam Chair.
She said the understanding of others' culture.
Okay.
Madam Chair. Peterson.
Senator Peterson.
I'm in queue. Is Secretary Carney still available?
Yes, Secretary Carney is still available. Secretary Carney?
Yes, absolutely. Thank you so much, Madam Chair.
No, I was going to ask you a question.
Yeah. Yes, Senator Peterson.
Yes, sir.
Go ahead.
And Mr. Secretary, I guess my question would be, and following up on what Senator Locke said, cultural competency is being aware of other people's culture. And we've identified African American history as one culture that's been underrepresented. But I guess my question would be, we have a lot of cultures in this Commonwealth. You come from a culture. I come from a culture. My wife's family comes from a culture. Who's going to decide which cultures we're going to study? How are we going to go about that process?
Absolutely. That's a great question, Senator Peterson. And as an extension of this work, the General Assembly also last year passed a bill to create a cultural advisory council at the Department of Education, which actually just launched its work a couple of weeks ago, that is addressing all the other different groups. So the Jewish American community, the Asian American community, the Latino and Latinx community, and our indigenous populations. So we're trying to be inclusive. This specifically, when the work was being undertaken by the African American History Commission. They had a couple of different tasks in the executive order. One is to look at the standards and the history, and also one to look at professional development. And there was broad consensus to really create professional development and create culturally responsive communities and culturally responsive schools. So cultural competency is a broadly used term in the academia, which has some variations of definition, but it's a broadly used term, which is understood in the education field. So it's an appropriate term to use in this instance and actually to codify. I think we're setting a very strong precedence by actually getting it specifically in this legislation and getting it codified and really start developing professional development for it. I do want to defer to Maria Burgos is an expert who has studied this for years. If there's an opportunity and we have time, she can go in more depth about cultural competency specifically, if you like.
All right, one follow-up question, Madam Chair.
Senator Peterson, one follow-up question to Dr. Carney.
And Doctor, maybe this is not a question so much as a comment. I think, and I'm going to support this bill because I trust you, and I certainly trust Senator Locke, but I would simply say that cultural competency, the culture of this state is changing all the time. It's maybe changing by the day. And it's pretty hard to nail down. And so I think one of the things you need to be studying is what brings people together, what brings us together. And so that's not a question but a comment, but thank you.
Thank you, Senator Peterson. Thank you very much, Dr. Carney.
Madam Chair, just one more question.
Senator
Yes, thank you.
Madam Chair, to the Secretary, because he has a lot of knowledge on this. To the Secretary, on line 24, actually evaluations of employees will be based on their cultural competency. What metric will be used to determine whether or not someone gets a positive or negative evaluation, job evaluation based on cultural competency?
Sure, that's a great question, Senator Newman, and that's where our Department of Education will have to work in developing model practices and those metrics, and they're gonna be actively engaged with VEA. VEA, which represents is the largest teachers association in the Commonwealth, and teachers and educators are the ones most impacted by it. And as you see, they're here to show their strong support in that. So we've been collaborating on this for a while. The professional development at the local divisions for cultural competencies has already begun in some of our school divisions, but it's not statewide. So we have some good model practices that we can use those specific metrics and as we integrate that in teacher evaluations.
Madam Chairman.
Senator Donovan.
I just have a follow-up question for the Secretary, if I may.
Yes.
Mr. Secretary, I'm just curious, as you make that point and you will be working closely with VEA to develop these guidelines, are you going to be inclusive of other teacher associations as well, or is it exclusively with VEA?
No, Senator Drummond, that's a great question. We're inclusive of all of the stakeholders. So we obviously have local chapters of FT as well. The AFT has a presence in the Commonwealth. And in all of our works and all of our groups, we engage all the different stakeholders and not just teachers, because educators are not just limited to membership of VEA. We have our Superintendents Association. We have also we engage our School Board Association, our PTA. So we have a very good mechanism where we include a lot of folks in this decision-making process as we go further and deeper down the line in developing professional development.
Thank you, Mr. Secretary. Madam Chairman, I have a follow-up question for the...
Senator Donovan, you have a question of the patron?
I do. Thank you, Madam Chairman. Senator Locke, is there a fiscal impact with this bill?
I'm sorry?
Is there a fiscal impact with this bill?
Yes, there is. In the governor's proposed budget, he includes $365,300 to support a cultural proficiency coordinator position and professional development.
Follow-up question, Madam Chairman.
Senator Donovan.
My local school districts had a specific question about the local cost and impact for them. The specific language that they sent to me, and we all know it's harder to get in touch, is that they absolutely support the bill, as I do. In medicine, we do training on this regularly. But They are worried about the magnitude of the mandate unless DOE develops the course, not just the guidelines. They need the course. They've asked that the course be developed, that the teachers can access it from an online resource, and that indeed they could even get additional funding to pay for the staff for ongoing instruction. I'm hoping we could maybe amend it to accommodate those things, because especially this year when our schools are under such duress just to buy PPE, and I know we're getting them CARES Act money and we're doing other things, but this is one more unfunded mandate that we're sending their way, and it would be superior to have it aligned with a kind of a singular course load, you know, one that's approved by the Department of Education. Is that possible?
We can discuss it.
Madam Chair.
Senator Hashmi.
Thank you, Madam Chair. And I may be incorrect, Senator Locke, but it was my understanding that the course would be developed at a statewide level so that there's consistency in standards.
Yes.
And I just want to speak in favor of the bill. I think this is quite necessary. I think we're moving in the right direction. And as the Secretary has already articulated, the idea of cultural competency is a standard knowledge in academia. It's a term that folks in education are certainly well aware of, and this is a good step in aligning our public schools with what's also happening in higher education. Higher education is moving to incorporate the knowledge and the understanding of what we mean by cultural competency, so that not just educators, but support staff, anyone who's working with students is capable of fully appreciating and understanding what we're talking about. So thank you, Senator Locke, for carrying the bill, and I'm fully in support of it.
Thank you, Senator Hashmi. Senator Locke?
Thank you, Madam Chair. Just to wrap up, I just want to point out that 52% of Virginia's public school students are students of color, while 82% of its educators are not. And further, most Virginia educators have not taken a course or completed any professional development in teaching African American history or culturally relevant practice and pedagogy, and this would move us in a step in the right direction. And with that, Madam Chair, I move that the bill be reported.
Senator Locke, this bill is...
and reported to Finance.
Yes. The patron...
Referred to Finance.
The patron has made the motion that the bill be reported and be referred to Finance. And there is a second. Please, we're going to vote electronically. Please let your position be known by voting electronically.
Senator Lewis?
Senator Lewis votes aye.
Ayes 9, nays 4, abstentions 1.
Ayes 9, nays 4, 1 abstention. The bill is reported and re-referred to Senate Finance. Thank you, Senator Locke.
Thank you, Madam Chair.
Okay, for the committee, we have one bill remaining, and that's Senate Bill 1276, and that's the patron is Senator McClellan, but that bill has been re-referred to the Committee on Commerce and Labor. So that bill will not be heard in this committee. It will be re-referred to Commerce and Labor. The motion is that the bill be re-referred to Commerce and Labor. Second. All in favor?
Aye. You can put this on the board,
Put
please.
it on the board, please. Please vote electronically.
Senator Lewis?
Yep, Senator Lewis votes aye.
Thank you for that
Ayes
motion.
14, no 0.
Thank you for the motion and the second. The bill, 14 yeas, 0 nays. The bill will be reported and re-referred to the Committee on Commerce and Labor. Thank you, committee. And if there's no further business to come before the committee shall rise.
I'm going to go.